raises the bed to a comfortable height for her. She begins with the client's neck, uncovering only the area she will be working on as she proceeds to perform each exercise set 3 times. Supporting the client's head with her hands, she flexes his neck so that his chin moves toward his chest, then tilts his head backward and then toward each shoulder. Then she moves to the shoulders, supporting the client's elbow with one hand and holding his wrist with the other. She raises the client's arm above his head, moves his arm across his chest, and then externally rotates his shoulder by moving his arm away from him. Next, she exercises his elbows by placing the client's arm at his side with his palm upward, then flexing and extending his forearm. She exercises his forearm by stabilizing the elbow, then turning the palm downward and then upward. Next, she moves to the wrist. Stabilizing his forearm, she flexes and extends the client's wrist, moves it from side to side, then rotates it. Then she moves to his fingers, extending and flexing them, abducting and adducting them, and then rotating the thumb. Next, she moves to the client's hips and legs. She flexes and extends the hip while supporting the leg and bringing the knee toward the chest, allowing full flexion of the knee. She adducts and abducts the hip by moving the client's straightened leg toward her, and then back to the median and then across the median. She performs internal and external rotation by turning the leg inward and then outward. Next, she exercises his ankles by bending the client's foot upward for dorsiflexion and downward for plantar flexion. She rotates the ankle in a circular motion. Finally, she flexes and extends each toe, then abducts and adducts each one. After this, she will move to the other side of the client's body and, starting at the shoulder, will repeat each exercise she has done 3 times for each joint. After you complete passive ROM exercises, make sure that the client is comfortable. Check his vital signs, lower the bed, and place the client's signaling device within reach. Then wash your hands and proceed to documenting your assessment of the client's range of motion and response to the exercises. Note whether or not the client experienced joint stiffness, joint pain, spasms, or extreme fatigue. Compare your assessment with the client's baseline data and earlier assessments. Record the client's vital signs. If the client is to be discharged and will still need passive ROM exercises, arrange the appropriate home health care or physical therapy referral, and teach the client's family to perform each exercise safely. Make sure family members understand that they must never force a joint through a movement, and that they must stop immediately if the client experiences extreme pain or discomfort. If the pattern of pain with movement continues, they should notify the provider. Body mechanics is a term used for the safe, coordinated effort of muscles, bones, and nerves to maintain balance, posture, and alignment during movement, especially bending, lifting, and walking. The purpose of proper body mechanics is to prevent injury, fatigue, and undue strain on the muscles. Without the use of proper body mechanics, back injuries are almost inevitable. With 24 bones in the back, all held together with ligaments and muscles, and stacked alongside and between major nerves and discs, any movements that involve bending and twisting in a multitude of directions can cause a wide variety of problems. Uncoordinated movements can sprain the ligaments, strain the muscles, rupture the discs, and irritate the joints. While it might seem that it would take a fall, a major straining movement, or an accident to cause back injuries, sometimes the simplest of movements can have painful results. To prevent injury, it is important to understand how body mechanics works and to apply it routinely during all activities that could possibly strain the back. Any task that involves lifting, bending, turning, or twisting motions can result in a back injury. In healthcare, the use of proper body mechanics is also essential for keeping clients safe. To practice good body mechanics, it helps to understand 3 concepts: the center of gravity, located at the center of the pelvis midway between the umbilicus and the symphysis pubis, the line of gravity or balance, an imaginary line from head to foot that divides the body into 2 equal parts, and the base of support, that space between the feet that bears the weight of the body. The 2 movements responsible for the most back injuries are bending at the waist and twisting the trunk. Adding lifting to either of these actions further increases the risk, so you'll want to be sure to avoid these movements. So when moving or lifting a heavy object, keep the line of gravity close to your center of gravity for maximal stability and to reduce the strain on your back. Bend your knees instead of your back so you won't lean forward or backward. Leaning would move your line of gravity away from your center of gravity. Opening the distance between your feet will broaden your base of support, thus distributing the weight you are lifting, increasing your balance and reducing the strain on your back muscles. You'll want to get close to the object and make sure your center of gravity is as close to the object as possible. This keeps your center of gravity in your line of gravity and offers the greatest potential for using muscle power. Let your arm and leg muscles do the work. These are nature's mechanical levers, and using them can prevent unnecessary back injuries. When using your arms, keep the load close to your body, as short levers require the least amount of work. Your greatest lift power comes with pushing rather than pulling. Thus, it is essential to use your legs and arms, not your back, to move the object. Practicing good body mechanics means paying attention to how your body moves. Maintaining your spine's natural curves at all times helps reduce strain on your back. It is also important to take the time to perform tasks carefully and properly, especially the ones that could cause muscle injury. Follow these guiding principles. Plan ahead. Think through and reorganize your activities to avoid high-risk movements like twisting and bending from the waist. Listen to your body. Stop and rest as needed, which is not always so easy to do on a busy nursing unit, but be sure to take advantage of break times to relax. Maintain good posture. Poor posture causes uneven weight distribution and can strain muscles and ligaments. Use smooth, even movements, never sudden or jerky motions. Lift with your legs, abdomen, and arms, not with your back. Before lifting a load, decide where it has to go and how to get it there, and move all obstacles out of the way. Bend your knees so that your arms are level with the object. Lifting overhead can easily injure your back, so use a footstool or a stepladder to reach high objects. Exercise regularly to strengthen your back, arm, leg, and abdominal muscles. And get help and offer help to others, because two people can almost always lift a heavy load easier than one can. A few more tips. Whenever possible, slide, roll, push, or pull objects rather than lifting them. It takes less energy. Use assistive devices like patient lifts and moving devices on wheels. Use your body weight by rocking forward and back to move an object. Keep your back straight and flex your hips and knees when lifting. Hold the object as close to your center of gravity as possible. When it is necessary to turn with a load, pivot, don't twist. Move your feet and turn your entire body along with your feet in the direction of the movement. So, to move an object, use the following steps. Get a firm footing with the feet about shoulder width apart. Bend at the knees and hips, not at the waist. Safely and firmly grasp the load, keeping the back straight. Hold the object close to the body. Lift with the leg muscles. Tighten the abdominal muscles when lifting. Pivot with the object held in close without twisting the trunk. Bend at the knees and the hips to put the object down. Using proper body mechanics will reduce the risk for injury for you and for your clients. Practicing safe lifting is a must for anyone who plans a lifelong career in healthcare.